So this is a presentation on HIV/AIDS, and it is with my colleague Lala, a group presentation, and my name is Vivian Grant. Now I will be presenting from clinical manifestation, the lower half of the PowerPoint. Please take a look at the PowerPoint as I speak. So clinical manifestations of HIV include acute signs and symptoms of HIV and chronic signs. So the acute signs can be 4 to 10 weeks, and the symptoms and signs are fever, joint pain, skin rash, sore throat, swollen lymph nodes. The chronic signs of HIV can last over decades, which is over 10 years, which is patients being fatigued, having diarrhea, weight loss, shingles, and lymphodenopathy. The complication of the virus HIV, patients whose immune system is suppressed are at great risk for opportunistic infections, such as pneumonia, which can affect 80% of all people infected with HIV. Respiratory failure, impaired breathing is a major complication that increases patients' discomfort and anxiety and may lead to respiratory failure. Now, if you look at this picture that I have here, on the right towards me, you have pneumonia in the lungs. And on the right, you have the normal lung, the healthy young lung. The bronchioles are healthy. The alveolar sac is healthy. But on the left side, you have a bronchiole that is inflamed. The alveolar sac, at the bottom of the sac, you can see where it's filled with fluid built up. And because of this fluid built up, gas exchange will not take place properly in the alveolar sac. Hence, the impaired breathing, which is a major complication. For treatment of HIV/AIDS, you have medication treatment. HIV is treated with medications, but most of all, it is treated with HAART, an antiretroviral therapy. It has been successful in the long-term treatment of HIV. This medication is used to attack the virus at various stages of its life cycle and suppress it. It comes against the virus. For nursing consideration, promote skin integrity. Patients are encouraged to avoid scratching and use moisturizers and non-drying soaps to perform regular oral care and to clean the perineal area after a bowel movement. The perineal area should be cleaned properly to prevent skin breakdown so the patient's skin will be intact. Promote usual bowel patterns. The nurse should monitor for consistency of stools and the patient's report of abdominal pain or cramping. Improve airway clearance for the patient, cough, deep breathing, and postural drainage. Percussion and vibration is provided for as often as every 2 hours to prevent stasis of secretion and to promote airway clearance. Postural drainage, meaning draining the secretion from the patient's body. Draining secretions from the patient airway and percussing, tapping the lungs so that the secretion, the sputum, will automatically be drained out. And this should be done every 2 hours and it prevents every 2 hours so that the secretion is not blocking the airway of the patient. Improve nutritional status. The patient is encouraged to eat foods that are easy to swallow and to avoid rough and spicy foods, sticky foods. Patients must eat foods that are easy to swallow because of the virus. They may have sores on their mouth, and the GI tract might just be affected. Sores on their mouth can cause burning while eating spicy food. The GI tract, which might be affected. The rough food might not be swallowed or might not be digested properly. Hence, no sticky food and avoid rough food. For prevent infection of the patient with HIV, the caregiver should monitor for signs and infection and laboratory test results that indicate infection. As soon as the infection has arrived, as soon as the infection is seen in a patient's body and the test results indicate infection, treatment should be done on that patient to treat the infection. In conclusion of this presentation on HIV, I would like to say HIV is an immunodeficiency virus. It's a virus that attacks the body's immune system. The immune system will be weakened. HIV, if it is not treated, if the virus is not treated, it can lead to AIDS, a further complication, which I spoke about in complication, which cause respiratory failure by pneumonia. So if it is not treated, it leads to AIDS. The CD4 cells are necessary for full functioning of the immune system. Therefore, their depletion, when they are depleted, the immune system, there's another deficiency, and the CD4 cells will no longer function in the body. It will no longer function in the cell-mediated response, nor will it help with the antibody response, which is the humoral response. Hence, the viral load of the virus has increased. It is high. It is higher than the CD4 cells count. The CD4 cells count have fallen below 200, which leads to AIDS. And I just want to make mention of my reference page, that you can go to the reference page and see the reference cited for this presentation. Thank you.